My name is Tracy, and I am 37 years old.
Every CNA should know that what they're doing is important. It makes a difference in the lives of the people that they deal with each day.
My name is Elizabeth. I'm 58.
I like to care, I like to help.
My name's Harold, and I'm 45 years old.
You have to be spontaneous and able to adapt and realize you're there to take care of the patient.
Tracy, and I'm 37.
You don't have love and you don't have patience, you don't need this job.
My first name is Michael, and I am 49 years old.
We're people first. We're not a disease.
The younger people with MS, they have more needs. They're more like you and I are. The elderly, you know, they're happy with playing bingo and getting their hair done. The younger people, it's harder to keep them occupied. They want to do more.
They want to be independent. They're not used to, sometimes they would tell you, I'm not used to people doing these things for me. I'm used to doing it myself. So it's more difficult for the younger person dealing with the disease and somebody trying to take away their independence.
A person with MS is not the same as another individual. That we are all very different, and that we all deal with MS in different ways, and that MS affects us in different ways.
You just need to know from one resident to the next that they're not all the same and that they are real people. And you have to treat each one a different way.
Aides are very instrumental in doing the things for me that I can't do.
Some things that they may normally do, they're able and capable to do for themselves on a daily. Some days they may not have the strength, you know, to do it, and then they would need your assistance.
Fatigue is a tiredness or an inability to complete an activity because you just don't have the strength to do it. It can be worse in the evening as opposed to the morning.
Maybe they can do it today, but they couldn't do it yesterday. But you go in the room and you'll ask them, you know, can you brush your teeth today? And sometimes they can.
We're there to help them, but not completely take over everything. Once a person, young or old, once they throw in the towel or don't use functions that they have less, then it takes away from them.
If they can wash their face and hands, let them do that. Sometimes it's the most important thing they do all day. I washed my face today all by myself. And you have to realize that those little things make them feel better.
In the morning, I'm strong, but by noon, I can't do the things that I did in the morning. So I'll need a little bit more help. It's hard for somebody who is not well versed in all the variables of MS to really comprehend.
People with MS have a lack of sensation to their skin. What that does is leave them open to formation of ulcers or pressure sores or reddened areas. They may not be aware that they need to shift their weight in a wheelchair.
Having your clothes on straight, getting straight in the chair, having somebody to take the time to make sure you're comfortable. And if I'm in my chair correctly in the morning, I feel a lot better all day long.
We have to remind them to do these things in order to protect their skin, and we have to examine their skin daily to make sure that we take care of any sort of reddened areas at that time.
As you wash them, check them from head to toe. They may have been laying in one position so long that now that there's a a pressure area.
You need to be very observant as far as new wounds on the body or new bruises.
People with an MS exhibit different speech variances. You may have somebody whose speech is very quiet and very soft and very difficult for you to hear. It's actually their disease fatigue impacting on their voice.
Not so much that you can't understand what they're saying, but you can't hear what they're saying. They can't get their voice, I guess, loud enough. Sometimes you have to bend in and listen because they can only whisper now.
I used to be an extrovert. Well, now I'm introverted a lot. Because I just don't want to talk very much because I lose my voice.
MS patients are very prone to heat prostration. They're very susceptible to the heat.
With MS, you have ebbs and flows in how you feel. For example, when it gets too warm in here or anywhere, I wilt.
It would be beneficial that they did understand that MS is heat sensitive.
If I'm too warm, my nerves don't do what they should do, and I get very weak.
To be a little chilly or cold is better for them than to get hot.
We have a product called the Drink Aid, which enables them to actually give themselves a drink of water or juice with a straw that's bendable and can be near their reach.
This system, which works great because you can hydrate yourself during the day without bothering, with an aide that might be busy doing other things.
With chronic disease, it's never going to go away. And the possibility of depression setting in is very real.
They've had homes, they've had families, or they may still have families. Sometimes, though, their families may not support them. They may not be there for them. Their friends that they had may not be there. The work that they may have done before may not be there. So you have all these voids happening in someone's life, and what happens is these people become depressed. They get sad at the loss of what they've had.
I was a nurse. I was public relations director. I was journalist.
I graduated first in my class in nursing school.
I was an executive secretary.
My whole life has changed. I could do things myself before. I love being able to take my dog out for walks, so I used to do that. And that's gone. I can't do it anymore.
If one day you're walking and doing everything for yourself, and then like in a flash, all that changes. You're in a wheelchair, and you have somebody helping you, it gets to your mind. It really does. And you start to have a low opinion of yourself.
People with MS get very emotional. It's a disease that hits younger people, and they are the ones with the families that are still functioning without them now. Just sometimes you walk out of a room and you cry. Sometimes I go home at night and I think, oh, I am so lucky. And to remember that, it keeps it real. Instead of just doing a job, you're taking care of people who have families just like you do. Communication is a big part. If you can go in there and talk to them, sometimes that's all they want is to have a conversation.
It makes the residents comfortable, especially the young residents with MS. And when they're comfortable around you, they have a tendency to be more willing to let you do your job with them and take the proper care of them.
Nursing assistants are trying to figure out what they can do for us. Ask us. Simple question, what can I do for you?
MS residents, they make up their own minds, they make up their own choices as far as what they want to eat, what they want to do, where they want to go. Their decision is theirs.
Help them. What do you want to wear? Don't just assume that the outfit you pick out is what they had in mind to wear that day. Give them a choice.
I put out my clothing the night before. Getting dressed, so you look halfway like a human being, which it's very important. I wear my earrings every day and my perfume, and I'm a woman, and I that part has not changed.
You go in with a nice big smile in the morning, how are you doing? And you talk to them for a few minutes. And I think they enjoy that.
I have to have somebody that talks to me. It's very important.
You go in with a positive attitude. It makes a big difference. When you walk in that room and walk in with a positive attitude, you're brightening up the day for that individual right away. They see you and they forget that they're even there with an illness, just the way you approach them.
When I find a nurse that cares and will take the time and will listen, and I will listen to her, and we have that give and take between us, that makes it better. And that makes handling and dealing with this disease much easier.
We like to not have MS, not to be here, but we need help. So it helps them when they're friendly to us.
I don't want to be condescending to me. I don't want to be patronized. And, you know, my hearing is fine, so don't talk loudly to me like I am an old person.
Treat them the way you would want to be treated if you were in that situation.
Treat me like an adult, you know, up here.
And to me, they're like family. Some of the residents are like family to me.
When you walk in the resident room and you see them and they're happy to see you, they be like, Al, you got me today, or, you know, you gonna help me out today. That makes you feel good because it makes you feel that when you was in there, that you was not only an aide, but you like a friend to them. And when they see you, they be happy to see you, you know, so it makes you feel good. You get a special feeling inside.
When you walk in there, I know the time is running. I know you got to take your break. I know sometimes you just want to get your job done. But sometimes you just have to be patient and give them a chance, go according to their own little slow pace.
You know in the back of your mind you have a lot to do that day, and it's 10 o'clock and somebody's taken 20 minutes just to brush their teeth and you know they want to do it. It takes a lot of patience. Sometimes you just want to say, give me the toothbrush, I'll do it for you. But you can't.
You have to have patience.
It's not about you. It's about that person. You got to deal with this mentally, you know, helping them. And they will take you through changes. They will push your buttons sometimes, you know, and, you know, you just have to have patience.
My first name is Marty. I'm 36 years old.
The particular patient I take care of who suffers from MS also is deaf. So when I first came into the home, it was a very difficult and new approach for me.
I lost my hearing when I was about 7 years old. It's never been pinpointed exactly why, but I had a series of ear infections which might have contributed to it.
Working with Marty has been quite an adventure because Marty is younger in age compared to working with the elderly. Marty's very vocal and humorous. He needs me to be his motivator and help him through his day and his daily activities.
The positive thing about having a home health aide, they bring me a lot of peace of mind. To know my husband's in good hands so that I know I'm not neglecting him, his needs are being met.
I feel very privileged to have a very nice, outstanding aide who's willing to listen to everything I say and adapt to it.
When you're taking care of a patient with MS in a home care situation, it's very different because you get involved in that person's life. You get to know them as a friend, not only as their caregiver.
It's gotten to the point where if we make a little bit of a mistake, we can just laugh and try again. I'm only human, so is it.
They're doing all of his personal care, bath, shampoo, assisting with shaving. It's very nice for me that if I have errands to run, I can feel comfortable leaving the house and going to pick up the dry cleaning, go to the supermarket, what have you, just take the baby and know that he's in good hands. There's nothing I wouldn't do for him. But not needing to be the one to do it day in, day out, I think, especially as a young couple, I think it allows both of us to still see each other as ourselves and not necessarily as a husband and wife where one of those partners happens to have a disease that's has to be dealt with day in, day out.
You have to have respect for one another. You have to value that life.
Just showing love and affection, you know, and what you give out is what comes back to you.
Look beyond the wheelchair that people are using. Look above the wheels and see the person that's sitting there.
You want them to have a nice day. You want them to feel good, that they are cared for, that you're there for them.
After spending time with a person for so long, you can't help but care about the person.
To be a CNA, you gotta be a special person. It's not for everybody. You gotta have the right personality, and you gotta be something that you really want to do. You can't look at it as just a job. You gotta look at it as something that's helping people.
This is what I love. I dream about it, and I just look forward to it, to come to work every day.
It comes from the heart. No medical book could teach you that. No medical book.